Without further ado, I'm excited to announce that today's presentation is the next in a series of virtual presentations by our partners at HHSA and Aging and Independent Services. I'm sad to say this is our second to last. We have one more next month in October, but it's been a great opportunity for us to collaborate at this level and rise above the limitations of the pandemic in terms of the ability to present information to our members, because that's a big part of what we do, especially relevant information to you as retirees. So stay tuned to the upcoming network newsletters. You'll see about the presentation next month, and more information on that. It's already out. It's already posted on our website. You can actually register for it. And I want to thank AIS staff for this great partnership and the opportunity to spread the word about the excellent programs and services that they offer. We are certainly going to take advantage of when we are able to meet in person at some point and have them present to our groups, just because that's the beauty of establishing this relationship. And then in October, we're going to have 3 presentations. We're going to have the next AIS presentation. We're going to have a virtual health fair on October 28th, which is going to be 3 of our partners, Pacific Group Agencies, who is our group benefit plan administrator. SD Sarah staff will be on board to talk about their open enrollment periods. That's what Pacific Group will be doing as well. And then also My Senior Health Plan, who I mentioned earlier, who is a wonderful partner of ours. And then we're going to have Nationwide, a representative from Nationwide who basically coordinates the deferred comp program with San Diego County. And it's for those of you that are in the deferred comp, her name is Kathy Purd, and she does a great job. So we'll be seeing that. But for today, we're pleased to be hosting today's presentation, Mandated Reporting of Elder and Dependent Adult Abuse, which is really about providing legally mandated reporters the legal requirements for reporting elder and dependent abuse. It describes the types and signs of abuse and the role of adult protective services and the long-term care Ombudsman programs. It fulfills the instruction obligations of employees and volunteers with public and private agencies. And Annabelle Kirkendall is a graduate of SDSU with a degree in psychology, has extensive case management experience, and has worked at nonprofit organizations. She joined the County of San Diego in June of 2000, part of the health and community engagement team, specifically working in outreach and education, and is the coordinator of the South County Action Network. And one day, soon, hopefully, she'll retire and become a ResDec member. I forget to get that in there sometimes, so I need to make sure I do that. So without further ado, Annabelle, I'm going to ask you to go ahead and you're still a co-host, I think. Yeah, you're still a co-host, so you can go ahead and I'm going to stop sharing. Oh, I have stopped sharing. Never mind. There you go. And you can go ahead and bring up your slides, and I'll turn it over to you.
Okay, can you see the slides?
Yes, I see your note slides though.
Oh, you do? How do we, this time, earlier we didn't, so how do I get?
Yeah, let's see. Did you
when we
go
did
through
that
the same
earlier,
process? Did you go through the same process when you opened it up before?
You
want to try that?
No. So maybe I should just stop sharing and redo it the same way?
Yeah, try that again, see if that works.
Okay. Let me try it again. Hold on a second.
I remember that screen. And I remember this one too. So I think you're doing it the same way as when we practiced.
Now,
Excellent.
can you see the without the notes now?
That's correct. We can.
Okay, perfect. Thank you for
All
letting me
yours.
know, Mark.
Thank-
Okay, thanks. Good morning, everyone. And I'm so delighted to be back. And also, I was sharing with Mark and Andrew before everyone came on that this is the very first time we're rolling out our newest Adult Protective Services presentation. So you're the first group getting this. It took some time for us to get it approved, but we're so delighted to say that we finally have a new version of our training. So we are glad that you're the first group that will actually be seeing this. We're unveiling the very first new version of Adult Protective Services. And we're going to be focusing on elder dependent adult abuse and also highlighting the services that Adult Protective Services provide, and also just to kind of go over the different types of protocols, guidelines, and also what makes someone a mandated reporter and what makes another person anonymous or permissive reporter. So as Mark mentioned, we are with the County of San Diego Health and Human Services Agency, and Aging and Independent Services is one of the many departments we have under HHSA. And we have many programs, direct and contracted services that serves our older adults and persons with disabilities. But as you know, our programs can vary from someone who's very independent, active, to all the way to someone who is more homebound or might be vulnerable and need more services. We rely heavily on volunteers, and I'm sure you could just imagine it's been very challenging with the pandemic. But we are starting to get a lot of our programs going again and doing some home visits following the public health guidelines and protocols, obviously. As we are not quite pretty much done with this pandemic, we're dealing with the different variants, which is right now is the Delta variant, and then the newest variant that's been identified is the Mu variant. So we're just hoping that we will just do our best to stay safe and stay well, and hopefully get everyone vaccinated. But that is a choice that people are making at this point, so we want to make sure we're being very careful, and that at some point, we are going to do more in-person presentation. We are doing that on a limited basis, but we still have to go over a lot of the strict protocols. And prior to setting up any type of presentation to seniors, we have to make sure everyone is masked up and everyone is distanced from each other. So we are making sure that we're not violating any public health guideline. So I'm going to go to the next slide. And this one, I just wanted to really highlight the main number for, this main number has quite a bit of function, but it also serves as a 24-hour hotline for Adult Protective Services, 1-800-339-4661. Some of you might still have our other number, which is that 1-800-510-2020. That one still works, but there's a difference between that one, the 510-2020, compared to the 339-4661. The 510-2020 number they're both toll-free, but the 510-2020 number, you must understand, in order to access that number, and for example, you're trying to make an APS referral, you must have the area codes for San Diego, 619-858-760. If by any chance, I'll use an example, Mark has to get a hold of San Diego County APS, and the alleged situation is in San Diego County, even though he might be outside San Diego County, then his phone number might be a 714 or outside those area codes. If he calls the 510-2020, it could be rerouted to Sacramento APS because it's not recognizing his number as San Diego County area code. So good rule of thumb, if just because we know a lot of people are getting rid of their landlines and they're using their cell phone, and everyone's cell phone could be from different area codes, the 800-339-4661 is the main number that will get you through to us, San Diego County Aging Dependent Services. But just to let you know, the 510-2020 still is available and functioning, but we have to make sure you understand the difference between these two numbers. So if you just want to avoid not getting rerouted somewhere else, use the 339-4661. So besides this number as a 24-hour hotline, it's also our information and assistance hotline. So it's a very busy number because prior to the pandemic, during the pandemic, and we're trying to get through a post-pandemic, this number, you could just imagine, is very popular, just like as much as 211, because people are trying to get as many services and trying to get food assistance, the Great Plates program, for example, as well as the vaccine rollout. How can we get people vaccinated at home if they're homebound or bedbound? So it's a very, very busy number. It's been a very, very busy almost 2 years because we have really received so many more calls because of all the different needs that arise from the pandemic and the challenges that we continue to see. But we just really want you to know that this number is very important. Have it, just have it handy. Or if you want to program it in your cell phones, it'll be a nice thing to just maybe put APS or AIS call center. So at least if you need to reach us, you already have it in your contacts. And now, since we're dealing with the mandated reporting procedure as well, we also want to give you the definition, what our state of California, what their guidelines and specific definition of a senior, or what we refer to as elder or senior, is anyone who's 65 and over. And then someone who may not be 65 yet, but they fall between the 18 to 64 years age grouping. They may have physical or mental limitations, and then their disabilities could be permanent or temporary. And we also need to know where they're residing. Are they in their own home? Are they in a licensed facility or in a psychiatric hospital, 24-hour facility? This way, we know which program has jurisdiction over them. So for example, someone who might be experiencing abuse in their own home, that would be an APS referral, Adult Protective Services. But if you know someone might be residing in a licensed facility, then that would go to Ombudsman program, which we'll go over that quite a bit later on towards the end of my presentation. But it's good to know when you're calling us, letting us know the name of the person, the actual allegation that might be happening, who possibly is the person or persons committing the abuse, as well as also where they reside. So this way, when we're taking the information, or we're looking at the online report or the SOC 341 form that would get submitted to us through fax, mail, or still, I think some people have locked it in, but now I don't think they're able to do that because we've switched to a PO box address. We could get an idea exactly which of our programs can respond. And just to let you know, just because we got that first referral, we operate on a multidisciplinary team approach. So we will have other additional agencies step in if they need to, because it's gonna take a whole community group collaborative effort from many agencies to assist a lot of our folks. Okay. Next one, and with this new presentation, we also wanted to include dementia-specific language. So we are really happy to at least provide you a couple of slides to let you know that, as you know, we have a very high case of folks that have been diagnosed with dementia or Alzheimer's disease or other related diseases, dementia-related diseases. And even though it's not a normal part of aging, just like what the slide tells you, a lot of folks who might have dementia are more at risk. and we want to make sure that if a possible abuse is happening, then we want to make sure we get there sooner than later. We want to give them the appropriate services and make sure that they're not going to continue with the possible abuse that they're experiencing, because someone with this type of dementia or Alzheimer's disease diagnosis are at increased risk of abuse. We also want to make sure that with dementia, there's a lot of cognitive decline happening, loss of memory, language, and ability for reasoning skills. So that's why there's a lot of things that could possibly go wrong, and maybe it's just the family overwhelmed, or it could be family members or caregivers, anyone close to that person now is going to take advantage of this person because of their memory decline, or their possible Alzheimer's disease, whether they've been diagnosed or not. They're going to use that to their advantage, and this person's going to be exploited in very many ways. So the next slide, which says living with dementia, is just to kind of really give you a little bit more of highlight some information when someone has impaired memory, communication skills, and judgment. You could just imagine that these folks may not be able or not capable to make a report themselves, to make a self-referral. They might not even know who to call, right? Or they may not even know that they are going through an abusive situation, because remember, depending on where their dementia is, at what level, they may not be able to understand the different things happening to them. So a person living with dementia can be more vulnerable to someone who can take advantage of them. So communication is key, and if they're not able to communicate, so that makes them more vulnerable. That person can get more isolated, and now the person or persons will take over, take control of them. And also another thing too is they're more than likely to fall for scams and fraud, because remember, they're not able to make that ability to make good judgment. And also because our scammers and folks out there, you know, are very good on what they do, and they could convince them, and they could become easy targets for scams. So another part I just want to point out before we move on is that someone living with dementia may forget to do activities to take care of themselves, like their personal hygiene, forget simple things like taking a bath or shower, and then next thing you know, they could become one of those folks that fall in the category of self-neglect. So it's important that we could get the support system that they need, maybe home health, or specific agencies that are specializing in helping and assisting people with dementia and Alzheimer's, or maybe they might be better off being placed in a facility that specializes with folks with dementia and Alzheimer's. So the next slide is just to let you know, it's very straightforward. Penal Code 368 just defines that any type of abuse that we're going to go over the different types of abuse anyways in a few minutes, but it just basically says it's a crime, and depending on the severity of the situation of the crime, it could be a misdemeanor or a felony. So next slide is just to give you the two different definitions of reporters. So mandated reporters, these are folks, professionals and volunteers who provide direct or indirect, paid or non-paid type of job to our older adults and persons with disabilities. We are considered mandated reporters. So the state of California tells us it is our legal responsibility to make a referral report to APS if we suspect any type of the abuse that we'll be going over in a second, because this what makes a mandated reporter's responsibility a little bit more important is they're both important, even though you're a permissive or anonymous reporter. As mandated reporters, we are required to provide a written report. And that's the main thing we need to make sure that gets completed as well. Now, if you're not in that category, anyone in the community, you're not a professional, you're retired, you're not volunteering, but that's why we always tell people, just because people are volunteering, we need to make sure we emphasize the importance of them as mandated reporters as well. But if you're just part of the community and you're not at this point volunteering and not associated with any agency providing services for our older adults, it could be your neighbor, it could be your own family, or it could be another family from another state. You can always call our number and we can provide you the actual APS for that specific county if you have at least the zip code, the area or the county of the person you're responsible for, so we can actually get you connected to that APS program. Now, as permissive reporters, anyone can make an anonymous report. So what you do is just make sure you have our 800-339-4661 number. You call it in and you let us know, give us the information of the person you're concerned about. If you know the person that's possibly committing the abuse, and of course their address is very important, so we know where we're going and we know what kind of residential status they're at, if they're living at home or somewhere else. So we could definitely get that person to the right program. What I'd like to just say is good rule of thumb also is when in doubt, call our hotline number. Our social workers are there to help you problem solve, and they could also be the ones to make the determination if it is indeed reportable to APS or not. We also want you to know that there's no penalty for false reporting. So we know you're doing your due diligence and everything is confidential, okay? Just making sure there's nothing else I'm skipping on my notes here. Now, we're going over the different types of abuse. And as you can see, they're not listed in alphabetical order. We specifically did the listing, especially the top 3, financial, mental suffering, and physical abuse are the most common types of referrals we get here in San Diego County. Now, it could be different for other counties and state, but at least it's consistent that these 3 are actually the most common ones we get here in San Diego County. But I could tell you the financial abuse is definitely probably the most common anywhere else. Back when I started, we used to refer to financial abuse as a companion case, but now it's the most common type of abuse. And a lot of this abuse could be happening all at the same time in one household, in one particular older adult or person with disabilities. So sometimes what could happen is we get the referral. It could be financial abuse. And then once we go out and do investigation and further intervention and assessment, we realize there's also physical abuse as well as self-neglect on the person who's actually experiencing the abuse. So it could be multiple types of abuse. But the most important thing, obviously, is for us to get there. And in order for us to respond, we need to have the referral. You will also notice that on the very bottom of the slide, there's a little asterisk that says self-neglect is not against the law, which is true. We will go over this a little bit more because just to kind of give you a heads up, since this is a California law and California is a self-determination state, that's why we said it's not against the law, because our adults have the right to refuse services, even though not to the best of their interest. We cannot force the services or just demand them to take the services. They do have rights, but there are certain exceptions to the rule, and we'll go over that in a little bit. So the first one is financial abuse, and you could see these are all the major definition that we use under financial abuse. And it can come in so many different ways. There's many indicators of financial abuse. It's also important to point out undue influence. And you can see that's the third dot point in the slide, where it says influence by which a person is induced to act otherwise than by their own free will or without adequate attention to the consequences. This is very common to a lot of our older adults and persons with disabilities. The person committing the abuse takes advantage of their power, their authority. They want to control the person. They will use all kinds of different ways to scare them, to threaten them. But of course, since this is the financial abuse component, they're very interested in that person's assets, personal items, effects. If they may have a home or it doesn't matter. It's a condo, a home. They have some sort of savings, retirement, pension. They're very much interested in making sure they have access to that, and they could also exploit them financially. And then, of course, when we factor in fraud and scams on top of all the different indicators of financial abuse, it just makes it so much more, many ways on how someone could be financially exploited. We just want to also point out that when it comes to financial abuse, it only takes $950 or more to make it a felony offense. And remember that $950 could be all sorts of combination, which leads me to the next slide. These are different types of financial abuse indicators, and you could see it could be someone now being named as the new executor person in charge of the person's trust, or their will has been redone, and now some family members or trusted friends have been taken off, and this new person is now named as the agent or executor. They could have access to their ATM cards, or now they are joint account holders. Missing items, personal effects, could be jewelry, checkbooks, and then it's in quotations, loans and gifts. And then, like I mentioned to you, someone who might have dementia or Alzheimer's disease, if they feel like they have loaned or given someone, then they could use that diagnosis to their benefit, the person committing the abuse. They could say, oh no, my mother never gave me any money. She didn't loan me money. That's just her. She's so confused. She doesn't know what she's talking about. Or no, she gave me her, diamond ring as a gift. She wanted me to have it and pass it on to the next generation, when that's not true. So they will use a lot of that to their advantage. And also it could be someone who has power of attorney or rep payee, right? We have many young adults that may not be able to control their finances, so they have rep payee, and those folks might just take advantage and spend all of the finances dedicated for that person with disability, but then they'll go ahead and spend money on their own, like their own personal effects. And now the person who should be using that money for their well-being may not even have the proper clothing, or not having enough food to eat, or maybe their medication. So, which leads also to lack of funds for basic needs. And so we've had plenty of former cases where our APS clients have lost their home. They did not know that they were signing a loan document, that they're like co-signers for car loans and credit cards. So now when that person takes off, they're in the actual account, or they have that contract signed, so they'll come after them. So there's just so many different ways that our aging and disabled population can be financially exploited. But I also just want to point out that I think some of you who might have attended the Don't Get Hooked presentation I did some time ago, we went over the different types of fraud and scams. We do have Don't Get Hooked booklets in English and Spanish. So if you are interested in getting that, we could mail them to you directly, or if there's enough people that might be interested, we could mail like a certain amount to Mark, whichever address location he wants, and then maybe the next time you get together, or he has your main direct address, they could also give it to you or mail it to you. But you could certainly request that to us so we could give you all the informational booklet and resources that we highlighted in that program. And I think you have the PDF copy uploaded in the website, so you could also access that with the ResDeck website. Now this one, the next type of abuse is mental suffering. And we just want to be mindful that this is the kind of abuse that maybe a lot of people might minimize or may say, well, you know, my son is very verbally abusive to me, but he doesn't hit me. But again, it's further precursor for more abuse when it comes to verbal abuse, you know, what happens behind closed doors. And we've had plenty of folks, and when I did case management, I had plenty of former clients on the phone, in person, basically admit to me that the actual mental suffering, psychological abuse is far worse than the actual physical part of it. There's a lot of threats, you know, all kinds of mind games they're using. They are trying to intimidate the person, and then making false or misleading statements. I'm kind of mentioning a lot of the indicators of mental suffering just to give you an idea that the different types of negative things that could happen when someone's going through mental suffering. It can cause, you know, depression, anxiety, post-traumatic stress disorder, and other mental health issues. So we want to really stress out the importance of making sure we get the referrals so we can get there in time. We could stop this type of abuse, and then maybe the person is better off in the care of a stranger or a professional instead of with family members or someone they trust. But now this person has really taken advantage of them and very, very much mentally, psychologically abusive to them. We do know that a lot of our folks that experiencing the abuse are very protective of their the people that are causing the abuse, because it could be their family members or they're related to them. So they're afraid of retaliation. They don't want to press charges against their own family members, but they need to understand that it's going to keep going and we need to make a change. And maybe we need to just to intervene and explain to them that there's plenty of other people that can take care of them and they don't have to feel they're stuck with that person. Okay. And I think I already mentioned a lot of the indicators of mental suffering, but if you want me to give you an idea what type of scenarios, I could give you at least one. It could be someone who is pressuring an older adult, and they want access, or they want the older adult to give them their ATM card so they could withdraw money, get cash to buy alcohol, or maybe use it for gambling, or unfortunately, maybe to purchase drugs, right? So they might mention to the older adult, you better give me your ATM or your card so I could get money, because if you don't, I'm not going to make your dinner tonight before I go. You're going to suffer and not eat, and you're going to be hungry. So those type of you know, intimidating behavior. And then when you think about it, that becomes, besides mental suffering, now you know, because there's the financial piece that makes it to allegation of financial abuse, including the mental suffering. So those are just some examples I wanted to go over real quick as we move on to physical abuse. we have two specific things we wanted to point out. The physical abuse, the first dot point is just a simple definition what basically physical abuse is. But as you know, there's just so many different categories that fall on, I mean, different types of physical abuse that falls under this category. And of course, one of them is sexual abuse. But then physical abuse could be bruises, skin tears. It could be chemical, physical restraint. There's just so many different types of things that could happen here. Besides sexual abuse, there's domestic violence. And the abuse can be different ways. And it's not limited to just acts of violence as striking, either with or without an object. It could be shaking, shoving, slapping, kicking, pinching, and burning the person or the persons. In addition, they're going to use, like say, maybe over or under medicate the person. Maybe they're under medicating them because they don't want them to run out of medications right away. They're spreading them out so they don't have to spend the money, or over medicating them so the person will just be asleep most of the day, so their caregiver or the person responsible for their care does not have to do a lot of service to them, because they'd rather be doing their own thing. So again, those are different types of things that could fall under physical abuse. And we also want to make sure that it's very, very much underreported when it comes to domestic violence and sexual abuse, because again, I have to let you know that most of the abuse, the people committing the abuse are related to the person. And so they're either ashamed, afraid of retaliation, or does not want to press charges. But as you know, the law has changed for domestic violence. Law enforcement will take care of that, and they don't have to wait for the person that is experiencing domestic violence to file or press charges. So the next slide are just more indicators of physical abuse. I kind of went over quite a bit, and just another case scenario could be a caregiver over medicates a 90-year-old who is bedbound to avoid providing personal care and assistance, which I mentioned that to you. Or it could be an adult child uses lap belt to restrain an elderly parent who is wheelchair bound. Another one could be a family member or members sexually molesting an adult with developmental disabilities. So that's why it's important for that referral to come in. It's important for APS to get in there as soon as possible, so we could protect the welfare and safety of the individual or individuals that are actually suffering or experiencing the abuse, and make sure we could get there in time and hopefully get the folks who are committing the abuse, get them, get law enforcement and get them out of the environment, put them away for a long time, because if we can get to them, they'll just do the same thing, go somewhere else, go to another county, another state, and continue causing problems and, creating and committing abusive acts. So the neglect by others is next, and we try to use some pictures here, some visuals, just so you could get an idea. So neglect by others, when someone takes on the role of a caregiver or the person responsible for however how many people, either as a family member or maybe it's their job. They could be a home care provider, or they could be getting paid from our one of our programs, In Hope Supportive Services, which is a state-funded program. Then they need to know that they're responsible for the care and custody of that individual or individuals, right? Because it could be more than one person they're responsible for. So the person should have their basic needs met, they have proper food, and also if they need to go to the doctors, they should have timely medical appointments. They're going to get to the doctors on time, or their medications, as well as their living situation should be in order. This picture shows you that you could be also saying, oh my gosh, this person could be a hoarder too. Well, possibly, It could be a combination of things, but maybe the person is just too frail or has so much limitation that they're not able to clean their place anymore. They're not able to even take care of their own personal hygiene. But that's why we need folks to help and step in and provide those service. But if those people who are supposed to be providing the service are not meeting the demands of their duties and responsibilities, that's when we go ahead and get them for neglect by others. So the next slide basically lets you know that indicators of additional neglect by others could be anything that could fall under this category. Again, family member, it could be a scenario where a family member leaves the older adult who might have dementia unattended or unsupervised. And this is a safety concern because what if the person wanders around or there's an emergency situation, they may not know how to access emergency or like make a phone call to 911, or they could easily fall if they're using the bathroom, or what if they're bedbound and they need help getting out of the bed and they need assistance with transfers, so they're not unable to care for themselves. Well, what we tell people, it could be unintentional, right? So we tell family members and folks, if it gets to a point where it's too much and you can't do it all, then maybe that's this case scenario I gave you. You can't leave them alone unsupervised if they need more assistance. So why not look into adult day healthcare, where if you're working during the day, at least they're in a safe place where they're being supervised and they're with their own peers and they're safe. So we really just want to let you know that it could be unintentional and maybe the caregiver family is just overwhelmed and they're just burnt out and they don't know it. And sometimes they might be taking out their frustration and possibly end up getting mad at the older adult or the person with disability, end up hitting them because they're frustrated, but that's not okay. So that's why we need to get there and provide all the services and do counseling and let them know that it needs to stop, because if it continues, it becomes willful, intentional, and that again, it could be with the person being physically, abusive. Now that becomes assault, and then we could go ahead and get law enforcement involved. And then it's a very sophisticated, high-profile case. It could go all the way to district attorney's office. So I'm just making sure here if there's anything else I want to point out. I know I'm trying to be mindful of the time. We're barely kind of almost halfway through, so bear with me if I might be going a little bit faster and a little bit on some of the slides, but I just want to get through everything so we could allow folks to ask questions. The next other types of abuse are very much self-explanatory. You can see abandonment is coming. Abduction is next after abandonment. And here's the actual definition, what abandonment is. And remember, there's different ways where people could be abandoned. It could be, you might find, we have responded to cases or referrals where the person was found at a shopping center, at a bus stop, or just in a location where they just thought maybe someone's picking them up, or they're just unsupervised. Or it could be a young adult with developmental disabilities. They took them to take the bus and then they left them unattended. And now maybe they were abandoned while they were like riding the bus. And then of course, maybe the bus driver will realize, you're not getting off the bus at a certain stop. So what's going on? So that might be another way where their caregiver family members might have made sure that they just put them in a moving bus, and then let them go so they could get lost or someone else will find them. So it's like basically leaving without proper care or supervision. And of course, we just want to point out to you, if somehow they ended up leaving the older adult or disabled adult in a hospital, that's not considered abandonment because a hospital is a healthcare setting, so it's considered a safe haven location. But what could happen at that point is that, let's say, emergency response staff will realize that, then at least what they could do is go ahead and call APS as soon as possible, so we can go ahead and work with them and get that person to a safe place, more on a long-term type of housing, or maybe they need placement or they need to be in a facility. Next one is abduction, which is pretty much straightforward, as we're dealing with the state of California. It's either removing or refusing to return them to California. And the primary reason for abduction is financial control. I could give you a quick scenario where a family member could persuade the older adult to relocate or move in with them. They promise that they'll take care of them and help them with their finances, but they'll end up exploiting them and gain full control of their money. And then the older adult is in a position where they don't want to stay with them. They want to move back, or they're not happy where they are. Then they might get stuck in there, and then the people they're living with will say, no, you can't leave. You're going to be staying here with us. So basically, they're being, at first they were being promised of certain things that they will help, but then they're basically financially exploiting them. So isolation is next, and the word itself, and you could just imagine with the pandemic, before pre-COVID, you could just imagine we already have quite a bit of a hard to reach population when it comes to isolated seniors and maybe adult with disabilities that feel very isolated. This is when, and then when the pandemic hits us, and then more people are more isolated, right? So you could just imagine how challenging it was for APS to do the investigation. And the height of all the cases, when you didn't have the vaccine, we can even get to them or see them in person. So everything was done in so many different special ways to try to connect with them. But isolation is a huge problem. And this is when the person or persons committing the abuse is basically has full control. They will cut off any kind of support system in place, block the mail, phone calls, letters, make excuses for, oh no, she's not here, or she's asleep, she's actually out of town. So all kinds of different types of excuses that they'll use to make sure that the person has no other communication or contact with anyone else. So this is why it's important. So if you feel like you can't get a hold of anyone, you haven't seen them for a long time, you're concerned about them, especially when this person has a routine, or you see them on certain, types of events, this is why you need to make that referral to APS, because at least once we get the referral, we could do a welfare check on them, and then at least they could be in our system. If more future referrals will be given to our referral hotline, then we know that there's a problem that is consistent, that it's happening. So we're getting more to the end, and so we could get the rest of it and wrap it up. So self-neglect, like I mentioned to you, is not against the law. This is when someone could be choosing, it's their lifestyle, it's their lifestyle choice. There's two kinds of clients in self-neglect. The easier ones to help and provide intervention services are those who realize that they do need the help and they need services. They do realize that, they come to a point where they can't do it all anymore. So unfortunately, the majority of our self-neglect clients are the proud, stubborn, this is my life. You're not going to tell me how to live my life. You can't make me. But we also want you to know that it's important for us to respect their decision. We're there to build rapport, offer services, and do problem solving with them. We're assessing for their safety, any risk factors, and also their capacity to person, place, or time. But if the person is basically just exercising, is their lifestyle choice and they're saying no, and we can't really say there's a safety issue, then we have to just respect that. And I know it's very hard because, you know, they could use the help, but there are some certain exceptions to the rule. If we know that there's a safety issue, or the person is, you know, a threat to self or others, or we could say that they are gravely disabled at great physical risk, then we know we could ask additional support and help from law enforcement, psychiatric emergency response team, and other geriatric mental health clinicians that are contracted throughout the County of San Diego that can help and do the mental health evaluation. And if that person meets the criteria, then they could go ahead and do a 5150, which is up to 72-hour psychiatric intake at the hospital. So we just wanted to also go over some of that. The picture actually we included here is, again, for educational purposes, we're able to share this for our training, is a person who is a lifelong alcoholic. And also you can see as much as a small picture, but he was also a hoarder of a lot of objects. You can see, besides drinking, you know, he has old cars in the backyard. Everyone responded to this person. He keeps getting referred to as paramedics, you know, social service, hospitals, everyone, but he kept saying no. But he was at capacity. We know that he's making a lifestyle choice, and he did not want to change. So unfortunately, the last time one of the agencies did a welfare check, he was found deceased in his home. So basically, there's nothing we could do. This is self-determination example of how, even though we have so many different agencies and programs, we're not able to intervene because the person just chose to live this lifestyle. Okay. In the indicator self-neglect, I think I mentioned quite a bit already on this one, and of course frequent fire code and animal violations. And for those who have pets, sometimes that kind of works out to our advantage because they do want to take care, and they take care of their pets better than they take care of themselves. So sometimes that could be a way for us to say, okay, if you really want to not lose your pets, you need to clean up your place and put it up to code. Sometimes we're successful, sometimes we're not. I'm sure you've heard of many different types of things in the news or the radio, newspaper, where we have serious hoarding issues with many of our, some of the homes that we have responded to. It's very chaotic. We already know which house it is. And again, they're just very much, very self-determined. It's their lifestyle. So, and they do lack a lot of the basic personal hygiene as well. Okay, we got through all of the different types of abuse, and this one is just to give you a profile of someone who might be committing the abuse. And if you notice, it's been taking a lot of practice on my end. We're also, besides the dementia specific language that we have included in the new presentation, we are also making sure that we're using words that we're trying to make sure it's trauma informed. So we don't want to keep using the word victim and abuser. So once we reframe elder abuse language, you have to understand, when we use one word before, now it's going to be several words to actually, now instead of an abuser, we say person or persons committing the abuse. So it's a little bit longer to describe, but we're just trying to really reframe the language as well. So hopefully I've done a good job trying to not use those words the entire time, but I wanted to just give you the reasoning why we're doing that as well. So these are all different indicators. I pretty much mentioned to you their profile when I was going over some of the case scenarios. They like to be the one in charge. They want to be the one talking. So when we go out anyways, we want to make sure we separate the person committing the abuse from the actual person experiencing the abuse, because we know we need to have privacy. There's no way the person who is going through the abuse going to be talking to us when their actual person committing the abuse is right next to them. So the next one is just to give you the behavioral characteristics of the person who may be experiencing the abuse. And these are very common types of behaviors and characteristics. They could easily deny it. They could just, basically say, no, I didn't mean that. They'll contradict their statements. They'll protect the person committing the abuse. Like I mentioned to you, most of them are family members or related to them. It could be possible language barriers, so it's important for us to make sure that translation services, appropriate translation services are available. They may not be open to talk to us, and that's why it takes some time for us to build rapport with them, because it's important, or they could be confused. Now with the dementia and Alzheimer's disease and other related diseases, we need to be mindful of that, because the person may not be at capacity, or it could be the person might have sundowning, if you know that term, meaning they might be confused later on during the day. So we have to be very creative in trying to catch them when they're more, at least they're more alert. But that can happen. So our APS workers are trained to do that. And we know it's short-term crisis intervention, but the main thing is for us to get there in time and address any of the allegations of abuse and make sure the person is safe. And we could address any long-term type of care services and support system before we close the case. I'm not going to spend too much time in here because I think I already mentioned it to you of what self-determination is and all the different types of exceptions to the rules. So it's right here when I mentioned to you earlier, and we will go ahead and request additional agencies and help providers that can go ahead and take care of the 5150 criteria. Now we're just going to go over real quick what Adult Protective Services does. So once we get the referral, then we have an assignment team that will review the referrals, and then we'll assign it to the specific APS office's location, because as you know, County of San Diego is a huge county. We have 6 regions, so we have offices all over San Diego County, and some offices actually have shared boundaries because there's certain parts of the county where we have more cases, so sometimes it's too much for one unit to do it, so it could be a shared one. It's always unannounced, obviously, for obvious reasons. We don't want to give plenty of notice, especially if the person committing the abuse is on site in the property with the person experiencing the abuse. And also we're always trying to assess for their capacity, risk factors, and how vulnerable. Of course, the safety of the environment too. We will work with many different agencies depending on the complexity of the case, right? It could be animal services, it could be law enforcement if there's a crime. We could be calling 911, first responders. It could be code enforcement, the health department, you name it. That's why it's an MDT approach, multidisciplinary team approach. We'll make recommendations and referrals. So once we close the case, there's only three different ways. Confirm, meaning there's abuse. Inconclusive, we don't have enough proof that there is abuse. And unfounded, meaning there's no abuse, okay? It's very common that we will get several referrals from time to time from the same person, same residence or location. But remember, we now have them in the system. We have a history, so we have to treat every single referral as a new referral. Doesn't matter if that person's been referred to us 6 months ago. We got to go in there with new set of eyes and lenses and just figure out what's different this time around. And it may take several different APS workers to find a way to build rapport with that person, and they might finally say, yes, I'm ready to get more services from you. So with the Ombudsman program, I just want to highlight to you, we're almost done. that when the person is residing in a licensed facility, remember, please call the Ombudsman program. You can see their 800-640-4661 numbers here. This is their toll-free number, and they're available Monday through Friday. If it's after hours, you can go ahead and provide the information in the answering machine for imminent situation. And our long-term care ombudsman works closely with skilled nursing licensing. And also when it comes to physical abuse that might have occurred at this licensed facilities, the AB 40 is in place. So besides ombudsman and the community care license folks that need to be notified, now law enforcement must be notified as well. The Ombudsman program has a lot of many different role for the residents in long-term facilities, and they can provide a lot of assistance and make sure that they resolve complaints, especially related to the care of and personal rights of the residents in that facility. The main number is the 800 number, but you can also call our local San Diego County Ombudsman program at 858-560-2507. But again, we gave you the 800 number because it's a toll-free number, okay? A few more slides and I promise we're done. And this is just a nice overview of what aging and independence services provide. It's just a one slide because, as you know, we can't give you our handouts information in person because we're doing it virtually. So this is just a way you can see here is the spectrum of our services for someone who's active, very independent, all the way to someone who might be very much homebound or in need of more services. And then along all of those programs, we try to promote intergenerational programs and partnerships, as well as many different services in between: senior dining centers, home delivered meals, case management program, caregiver support is important as well. And of course, HHSA, one of our biggest program that's state funded, where we could let people stay home in their home as long as they have the proper support services so they can avoid placement. The two websites here in the blue is basically how you could get to AIS website, and we have plenty of many different information services programs listed there, as well as the coronavirus-sd.com that gets updated, and you will get a lot of COVID-19 information. Even right now, we're focusing on the booster shots, the vaccines, and still whatever new information we get, we actually post it in that website. And remember, our services, we have a lot of services we offer in San Diego County. And if for some reason that particular service program that you're looking to have, or you might want to maybe give, someone might be eligible for, if we don't have it, the next best thing we could do is refer you to another community-based organization or nonprofit agency that possibly can help, okay? So you could start with us, and then we could also assist you with additional referrals. And then the resources here is just basically to let you know, besides making a verbal report at the call center hotline, we have an online referral system now where you can refer people to our case management programs, as well as Ombudsman and APS. I've also given you the very long link to get familiar with the SOC 341, which is the most up-to-date APS reporting form, which is November 2018, because it gets updated every so often. Again, this is mainly for the mandated reporters, because when you're a permissive anonymous reporter, then you just need to call us and provide the information. And finally, this is just a quote we added, and we were glad that we're able to save this quote because we think it's a really nice way to end. And as you know, everyone pretty much know who Mr. Rogers was, and This one is just a quote that I'm just going to read. We live in a world in which we need to share responsibility. It's easy to say it's not my child, not my community, not my world, not my problem. Then there are those who see the need and respond. I consider those people my heroes. So we thought this quote is just basically very important, that when it comes to our aging and disabled population, we must continue to advocate for them. And some of them need so much more help, and we can't forget about them. And we need to all act together, work together collaboratively, so we could make sure they could have a nice quality of life. And we're all heading there ourselves. So I think we might as well get as much information we need now. For now, we're helping our family members, friends, and neighbors. But at some point, it's nice to know that if you have such a personal need that comes up, you can turn to us and we could help you, and we could provide the services that we need. So at this point, I'm going to go ahead and stop sharing my screen and then let Mark check out the chat box or any questions, comments from our attendees today. I'm sorry I went over a little bit, but this is the first time we're rolling it out, so I'm still kind of trying to gauge in with the time, but appreciate everyone who's staying on past the time.
Thank you so much, Annabelle. And actually, can you start your video? It's down in your left-hand corner. I think you have your video off, Annabelle. I don't know if you can start it.
Oh, sorry.
Oh, no worries. There she is.
There's my video. I was trying to mute myself. I entered the wrong. I'm also looking at the chat box too. Are you calling out on someone that might?
If anybody has a question, I'm going to just cover a couple things. But first, I'd like to thank you once again and everybody at AIS for the great partnership and the great presentation. You know, this issue, sometimes you don't realize how much there is out there, how much elder abuse and how much neglect that goes on. And to realize that the county is so proactive in providing services that are an email, a phone call, in terms of whether that's abuse from a family member, whether it's abuse from a stranger. When we all get to that age, right, we are the most vulnerable population, and we are the most apt to be victims of such crimes. So I think it's great to hear, just great to see the work that you guys do. Actually, we just got a question. Hold on, I'm gonna see if I can find it. Oh, actually, you know what, I'm going to share. She just wants to know the difference between the two numbers again. What is the difference between? I'll share the slides. I have it on a different slide deck.
Yeah, I know there's other questions too in the chat box, but we'll start with that one. And basically, the two numbers, the one that you see in the PowerPoints, the 1-800-339-4661. That's the main number that we'd like to get everyone more just familiar with, because the other number, even though still is being used and it still exists, the 1-800-510-2020, because in order to use that to get it to us, you must have 619-858-760 area code. But if you are outside those area codes and you happen to use the 510-2020, you can get rerouted to Sacramento or not directly to San Diego County Aging Independent Services and APS. So this 800-339-4661 would be the best one to save in your contacts folder, just so you don't have to worry about which area code you have. But I just wanted to make sure that if you're familiar with our old number, it still is in existence. But just to be on the safe side, the 339-4661 is the main one, so you don't have to worry about being rerouted to Sacramento APS or not get to us on time. Okay. Actually,
that is the one question so far. All that other chat was between myself and staff before, so those weren't questions. But what I wanted to tell people, if anybody else wants to think of a question, and send it along through the chat function. This slide deck I have a copy of, and I believe it's okay if I share it. Is that correct, Annabelle?
Yes,
Okay.
I gave Mark a PDF version, so you have access to this. Either you could share it to anyone who wants it, or you could even upload it in your website, because it's just basically the language information. And definitely Mark has a copy of it if you want to go ahead and request one from him.
Yeah, all you
Um,
need to do is send us an email at resdec@resdec.net, which is now on your screen. Does everybody see that? You see that, Annabelle?
yes.
Okay, great. So that's the easiest way for you to get that, and we'd be happy to send it. I want to stop sharing here and go back to the PowerPoint, because I think it's and Annabelle mentioned this in her presentation. What's nice about even on the PDF version is you can click on the links and it'll pop you out to the website. There it is, Aging and Independent Services. So that's a really nice feature
Yes.
of having those links on there, and we certainly appreciate you sharing that PowerPoint.
Yeah, we like to do a hyperlinks, just so if you have that in your desktop, it will get you directly to our website. So it's so much easier than typing it in or searching it. So yes, we want to make sure we try to make it very convenient, easy for everyone else.
Great. Actually, we do have a question, because this person sent it to you privately, so I'll go ahead and ask it. Are ministers mandated reporters?
I saw that in the chat box, because we do have different types of mandated reporters. There's one specific, the one I presented to you is more of the generic version for all mandated reporters, but there's certain groups identified under welfare and institution codes that are considered mandated reporters. So there's a different number grouping for first responders, for example, like law enforcement and fire department, as well as clergy are also have a different welfare institution coding that are actually mandated reporters. With the clergy, I just want to make sure, let you know that you're only exempted not to say anything, report anything, if you are in a confessional box situation. That's how they wrote the welfare institution code under clergy. But also, I just want to remind everyone, regardless mandated or anonymous reports, everything is confidential. We will not disclose any information to anyone who made the report, or, even though people are going to try to be tricky and say, oh, no, I need to know, blah, blah, blah. We can't say any of that because it's confidential. You're protected by the law. And as ministers, we do know a lot of people feel more comfortable talking about serious type of situation with clergy, with their spiritual advisors, with their faith community. So we really want to really educate and tell our faith community to get to know our services and get familiar with our APS hotline, because we will definitely want to make sure if you have a lot of concerns and there's allegations of abuse, that you realize that you have that legal responsibility to report and refer folks to us.
Great, thank you. And I would imagine that's all inclusive when you say clergy, because they also ask related to ministers, phone prayer.
Correct.
I would
Correct.
imagine
It could be like office staff answering the call, right? And then someone might just disclose additional information, because anytime you have any kind of knowledge of a possible abuse happening, whether it's true or not, you have knowledge of a possible abuse. So the best thing I could say is when in doubt, please call it in and let our social workers on the hotline make the determination and help problem solve with you.
Great. Well, I think that's it. I do not see any other questions.
There's one on the chat. Let's see. I have a family
It might
member.
be yours. If you have private messages, go ahead and if you want to just read the question, because I can't see those.
Oh, you can't see that. Oh, I see. It's a direct message. So let me go through the chat box. So
Sure.
I have a family member who's in a nursing home. She's bedridden and needs 24-hour care. She's about to run out of money. What will happen to her? Ooh, that's a really tough one. Basically, what I would say is I would talk to all the staff at that particular nursing home, as well as get a hold of the Ombudsman, and also make sure you consult with them and also find out about the health insurance and all the coverage that they need. I don't know the specific of that particular person you're referring to. Again, Medi-Cal, Medicare, you need to know if they need to qualify for that, because at this point, if finances is an issue, we need to make sure that we could get additional folks to step in and assist with that. So the person, they just can't like say, oh, we're gonna go ahead and get rid of her because you can't pay us. Because again, that would cost us, they're going to abandon or kick them out. So I would definitely use all the different channels of communication with Ombudsman program, the staff there, and also find out about how you could get those additional programs to come in and how they can qualify. Because if Medi-Cal, Medicare should be able to assist with those type of costs when it comes to those type of licensed care facilities. Let's see here. I'm going to go on the very top. I think I already addressed the church prayer workers on phone are mandated reporters. I think I already mentioned to you, if you have a certain event that's kind of more like on a faith-based basis, when in doubt, just go ahead and make an anonymous report and kind of consult with our hotline workers. And then just this way you could kind of talk about it and find out if this is something that we need to take on as APS, because we do know it's never black and white. I understand that there's a lot of shades of gray. So we really want people to feel comfortable calling our hotline and having a conversation with our social workers. And there's one that says ministers also mandate reporters. So we already addressed that. Copy of the PowerPoint. Yes, you can get that. When did the phone number change? The phone number has, the 510-2020 has always been there. It's never changed. We added the 339-4661 number. Oh gosh, quite some time ago. I can't tell exactly what year we started adding that, because we were realizing, because everyone's using cell phone, are outside the 3 area codes, and they're getting rerouted to Sacramento. So that's when we had to act quick and come up with an 800 number that will capture those folks outside the area code. Let me see here if there's anything else. I think I got everyone's direct message, unless anyone at this point has additional questions or comments. I hope you like the new version.
Yeah, it was great. You did a great job.
Okay. Oh, you're welcome. I appreciate everyone coming in today.
Thanks, everybody.
And Mark, if you could just send me an email, or I don't know if you could tell me exactly how many total people.
Yeah, we had I think 10 overall. And we had a couple staff, so we had about 12, 13 total.
That's what I saw earlier, about 12, 13.
Yep.
Okay.
And
well,
then the thing is too, is I would check with us as a follow-up. We can tell you in terms of views it's had on our ResDec YouTube page after it's posted for a while. And this presentation should be posted in the next day or two. So you can access the presentation, today's presentation, on our YouTube ResDec page. Like I mentioned at the top, at the www.resdec.net website. Thank you, Annabelle.
Okay, sounds good. It's good to see you, Mark
everyone.
and Andrew. And
Thanks everyone
so much
for joining us today. And I will close the meeting out. Take care.
Thank you. Take care. Be safe.
Bye-bye.